On behalf of the Open Access Scholarly Publishing Association, OASPA, I'm delighted to be convening and moderating today's session. My name is Amit Doshi. I'm from Princeton University Library in snowy, icy New Jersey today. Hopefully we'll get some less frigid temperatures soon. This is going to be an important and hopefully invigorating discussion about open access today. And we are fortunate to be joined by such an esteemed group of diverse practitioners, scholars, leaders on today's panel. Over the next hour, we'll learn about how they and how the people and organizations that they represent utilize the best openly available evidence to improve health outcomes, provide important services, communicate groundbreaking science to the public, and a whole host of other activities. Before we get started, I'd like to remind attendees to please enter questions into the chat, as we'll leave plenty of time for Q&A. And I'm thrilled to also announce that we have had over 950 registrations from 78 countries for today's webinar. So clearly this topic has struck a chord. And I'm just so delighted that we've been able to make this happen. So with that, let's begin by introducing our panel. Lacey Lagrone is a trauma surgeon at University of Colorado Health, UC Health, with graduate training and 9 years of research experience in dissemination and implementation science. Lacey's experience in global initiatives to understand and address barriers to clinical guidance, access, and adherence positions her very well to connect across disciplines and contexts and to discuss the on-the-ground impact of having access to openly available clinical guidance. Beth Daly is the executive editor and general manager for The Conversation US, where articles are written by academic researchers in their respective areas of expertise and then edited by The Conversation staff to ensure a balance between reader accessibility and academic rigor. At The Conversation, she emphasizes the importance of open access and of sharing ideas openly. And finally, Joy Connolly began her service as president of the American Council of Learned Societies in 2019. Previously, she served as provost and interim president of the Graduate Center at the City University of New York. She's also held faculty appointments at NYU, Stanford, and University of Washington. Joy's committed to broadening scholars' impact in the world, advocates for the value of the full range of humanistic methods and topics, including, and importantly for today's discussion, publicly oriented and community engaged scholarship. Today's discussion is focused on how the public benefits from open access. And as we've just seen with the numbers of attendees, there's great interest in this topic. And this is because from the very origins of the open access movement, advocates have continually invoked the importance of providing this access to those outside of traditional university and research networks. Yet understanding the impact that open access has on these individuals is very challenging. And so today's conversation aims to advance our understanding of this public impact of open access. And with that, let's start big picture. Why does open access matter beyond academia? Who are these audiences that benefit the most? And how do we know that they're engaging with this contest? Lacey, from your experience in global health, what difference does open access make for frontline health workers?
Well, it makes all the difference. I think it's foundational for people to be able to participate meaningfully in improving their systems. My experience in this regard was 10, 15 years ago. I was a Fogarty Fellow, and my mentor wrote the World Health Organization guidelines for trauma quality improvement. And I spent a year in Peru doing interviews with surgeons, asking a lot of whys. If you're not doing this, why? And ultimately it came back to, if we don't have access to the gold standard, then when we do process improvement, when we review our cases, when we maybe want to coach our peers, it's one opinion versus another. But if we can't access the gold standard, then that undercuts our ability to elevate the care we're providing in every way.
That's great. Thank you, Lacey. Let's move on to Beth. Beth, I've been a reader of The Conversation for several years now, and I love the idea of academics being, say, nudged to speak in more kind of understandable terms and like demystifying the jargon. So how does open access influence the quality and the reach of the journalism that you do at The Conversation?
So two ways. Thanks, a great question, Amit. So we rely on open access research papers often. But I would say more often what we do is take ideas that we believe should be open access and share those with the public. So they may be locked behind a paywall, they may be locked behind a journal, but the ideas are really the gold. And so we work really, really hard to make sure that gets out to the public in a way that is open access for everyone to use and as they see fit. The conversation is not just a website. We take those ideas and make them freely available for anyone to read and republish through a Creative Commons license. And as a result, I mean, just last Thursday, our content was in 1,312 news outlets because we allow those ideas to flow freely. So, I wish everything was open access from the start, but when it can't be, we provide sort of the bridge to get it there through our staff and academics who are willing to write.
Thanks, Beth. And on to Joy. Joy, I think the humanities is in a unique position with this larger conversation about open access. In your view, how have the humanities adapted and embraced open access, and what kind of examples have you seen of open access kind of happening in the work that you do?
Thanks, Amit, and thanks everybody, and thanks to my fellow panelists. It's good to be here and talking about this because it's about knowledge and about truth, which is something important for us all to think about, especially in the United States, as we look at the state of public discourse. So I'll say, first of all, I should say humanities and social sciences because ACLS's remit embraces the social sciences as well, and our member societies like the American Anthropological Association and American Political Science Association would be sorry to be not mentioned. So I'll highlight that. But I would say there's a story, kind of big point, and then a couple of examples. There's a story out there about humanistic and social scientific academic research that you'll see really everywhere, not just Fox News, also CNN, also, the newspaper, really everywhere. It's a very popular story that humanistic research, I'll call it, or humanistic inquiry is out of touch. It's irrelevant. Scholars only talk to each other. It's highly specialized. It's left wing or it's elitist. It's inaccessible. It's like opera. I mean, Beth, you're exactly there are some truthful pieces to this story, and you're addressing that head on. But there are more, as Beth knows from her work and her success in convincing or providing that bridge for academics to walk over. There are many scholars inside the academy and outside and adjacent whose work and writing style is accessible and who are doing the work of producing and circulating knowledge that in the public interest or the public good. So we're not opera, and I love opera, by the way. But that public sense of opera being inaccessible and elite, we are rock and folk and country and disco. Humanistic inquiry is across the board, and we are plural, which makes it actually tough to defend sometimes because we're everywhere. So I'll just say that community engaged scholarship or specialist scholarship in the humanities and social sciences has public audiences everywhere if we can reach them. And what open access does, and now I'm getting to the example, is a couple of examples, is it helps reach the public audience, many publics in nuanced ways. So it isn't a kind of namby-pamby, look, we're interested in issues of the public good. It's like there there's there's there are topics and methods that appeal to absolutely everybody in the wide range of humanistic scholarship. So, and I shouldn't have said namby-pamby. That's a good message, but it can get very blah and sound very cooked. And there's something spiky and something and spicy and in its detail and in its specialization. Fascinating things are going on in humanistic scholarship. So anyway, I don't want to go on too long. I will just mention one of the ways in which ACLS, my organization, the American Council of Learned Societies, is trying to advance this is by lifting up great works of open access scholarship. So we're really proud to work with the Arcadia Foundation, which funds our Open Access Book Prize. And I think we'll be sharing a link to that at some stage, if not already. I just want to mention one amazing book. It's called it's not a book, it's a multimodal project. It's called Feral Atlas. And Beth knows about it. It's the full title is
Amazing. I
Feral.
don't mean it, it's an amazing
It,
book.
it is amazing. Feral Atlas, the More Than Human Anthropocene. It's a multi-authored or multi-produced work out from Stanford in 2020. I won't even try to describe it. You just have to go look at it because it is an immersive website about thinking about the environment, and that's what humanists and social scientists are doing these days in the academy, and that's what the public needs to know.
That's
I think,
wonderful, Julie. Yeah,
oh,
I'm curious. Any title with the word feral, piques my interest. So go on, please. Beth.
no, I just was going to echo what Joy said because what ACLS does is so important, and the humanities and social sciences is everywhere. And I just want to like say we see it, like we get emails, well, mostly emails and texts every day from people saying, "Hey, I read that, qualitative work, and I'm going to my city council with it to talk about this housing issue, or again and again." So I really want to say that that open access is here, but it really trickles down to individuals in a way that's very meaningful in their life and policymakers as well, certainly, but also individuals. I just want to kind of, you know, hone that point.
Hearing all three of you discuss the impact on happening on the ground, I worked on a paper with a colleague at Georgia Tech, Diana Hicks, and we looked at the effect of open access to National Academies reports. And I think we were surprised that certainly, like we expected academics and students and scholars to be using these reports, 50% were non-academics. So they were downloading these openly accessible reports, and we had 64 categories of use. So it's a very diverse array of uses in this case, just one type of openly accessible information, but certainly as Lacey, as you pointed out, a gold standard. And I think what was particularly compelling is you see people trying to improve services on the front line using the best available evidence that they have. And, Lacey, you mentioned your work in Peru. What are the consequences of not having access to that literature? Is it palpable when people don't have access to the clinical guidance that you're seeing like negative outcomes, or does it somehow trickle down in other ways?
No, I would say untold preventable harm and death that it has not been quantified, but we know is real. So in medicine, we recently named a science called implementation science to say how do we bridge the gap between what we know, and what we know is what's in the peer-reviewed literature and what we're actually doing. And the reason that was founded is because on average, patients are receiving care, and this is in high resource, high income institutions, that's 17 years behind the evidence. And there's a myriad of reasons for that, right? Like maybe the provider doesn't have enough humility to know they don't know, so they didn't look it up, et cetera. But we know that one of the hugest barriers is the material being open in the first place. And so I think that I trained at Harborview in Seattle, and we had awesome rescues all the time. Like a gal was dead for 2 hours and she walked out of the hospital 2 days later because she was cold. You can survive a long time dead if you're cold. But we had all these awesome rescues. But really, how we made a difference in saving lives is the tiny micro moments where a patient gets their antibiotics 20 minutes sooner because the frontline provider knows that in this instance, you've got sepsis, you need to receive antibiotics as soon as possible. That's associated with mortality. And it's the value of incremental gains. There's a British cycling coach who apparently took the British cycling team from being one of the worst in the world and one of the best in the world, and he did it by 2% better in everything, a 2% lighter seat, 2% better nutrition, all of these incremental gains. And really in medicine, that's how you save lives. It's not heroic like attempts to get an airway or whatever. It's by making 1,000 really good decisions. And as you can imagine, 1,000 really good decisions takes a huge body of information to inform that. And so I have experience in Malawi and other countries around the world and work with a lot of global organizations, but I will tell you, this is true everywhere. This is true for my partners at the Brigham. This is true in Seattle, where I train. This is true in Denver, that everyone is receiving care that is on average very out of date. And even then, only 1 out of 5 effective interventions makes its way into common practice. And so I think that particularly, I'll add on one to what you guys were talking about, especially as we move from a push mechanism of communication, at least within the health community, right? People used to sign up for journals and they'd read everything in that journal. Now we're moving to a pull mechanism of communication. Medical students, junior trainees, and young physicians are going to ChatGPT to make decisions about the care people are receiving. And that's true around the world. And it's not well documented yet. I'm working with the people who are working on documenting it. But as you can imagine, open access matters all the more when people are going to that pull mechanism that is just scraping the entirety of the internet.
Yes, that's a phenomenon that we certainly see at universities as well, is you know some of these AI tools as first the first stop, and your point's very well taken there. Beth and Joy, one of the things that I've heard recently in both explicit terms, but also implied in a variety of different meetings I've been in, is that academics and faculty now are almost required to become public intellectuals, because there is this divide between what the public believes academics, universities, faculty are doing, and the taxpayers' kind of reluctance to continue funding research institutions. And you see this in some of the survey data. A lot of this is influenced by just the cost of university educations and funding at the state level. It's a very kind of complex topic. But I think at the end of the day, there seems to be this sense that faculty in particular need to get out into the community more, perhaps publish in the conversation or other kinds of op-eds in local newspapers and so on. Is that what you're seeing? And is there a role for open access to play here in this kind of movement towards becoming more public and more open?
Shall I jump in on that one
Sure,
to
Joy.
start, Beth? And then the, you know, I it's a mixed message, I would say, faculty are getting. Because on the one hand, you will hear faculty sometimes celebrate, sometimes complain about administrators in particular, maybe sometimes saying they're passing the message from trustees that they should be out there, that they should be public intellectuals, that they should be writing for the conversation and writing op-eds, et cetera, out in the community. But speaking of that 17-year gap that Lacey mentioned, that I'm still, like many people, am reeling from as I think about that. We're in a similar, I mean, it's not an exact correlation, but it works as an analogy. We're in a similar gap when it comes to the faculty reward structure at many universities and what you mentioned. So both are true. So it really puts, especially, and I don't want to sound ageist here, but especially those incredibly dynamic and innovative, energetic young voices, people who want to try modal publishing. They're, a historian who works on the history of hospitals, who wants to work with a scientist who wants to, blow up all the walls that silo people off and write work that will produce work that will change the way people view medicine or medical science or health sciences, but is told, publish the book with the university press, wait till you get tenure, and then you can do all those interesting things. And I'm sorry, but the human brain and human people, in my experience, it just doesn't work to wait 10 years, to do that work that is keeping you on fire. So it's a real problem. And until we figure out a way, whether it's, I've gone back and forth, whether it's R1 universities, highly research active universities leading the way, but then I worry they're the people who have won the game. They don't really have any reason to change the rules. So, Is it the R2s? Is it the R3s? Is it people in community colleges? Is it other, groups of faculty and people outside the academy who can come together to say, we've just got to change the way we reward faculty and the way we rank universities? It's all tied together. It's very hard to find the levers that will move this system, but that's where we are now, is with a gap between what people are hearing, what scholars are hearing, and what they're being rewarded for and, literally paid for and promoted for.
Just, 17-year-old thing is still, Lacey, I think that's such an important point, but that's like, we continue talking about that because I think of a lot of questions because
That's the
that's what they have.
stat of the
But it makes
webinar,
sense.
I think.
It makes sense, that delay, like, and we talk about it, but I'll just say I'm not an academic. I'm a journalist. I was a journalist at the Boston Globe for many years, mostly in hard sciences, and ultimately left there when I was a climate reporter. And I give a lot of talks on climate, and I would walk into a room with all these researchers who research on climate. I said, how many of you got into research because you want to help save the world, in some way, figure out solutions, slow down, mitigate climate change? Everyone's hand is up. And I say, how many of you can actually explain what you do to the public who you're trying to help? And everyone's hand kind of goes down sheepishly. And we get in discussion about this crazy, forgive me, mixed up and backward sense of reward system in academia. And I don't understand it. We can talk about why it happens. I think many people on this call know why, but just as a slight outsider, even though I run the conversation, it's baffling. But because frankly, the public is funding a lot of the research. And if you're funding the research, you got to tell the research, you got to return the research back to the community you are studying and tell them what you found and tell them how the lives can be improved. Other thing I'll just say really quickly about the reward system is some universities are changing. I can think of like University of Michigan, Colorado, I think is working hard. At the conversation, just so people know, we're international, so we're in about 14 countries, each separate conversations. In some universities care so much about public scholarship that our scholars write for free. You get something out of it, which is like learning and learning how to be a public scholar, but you do for free. So it comes at a cost of you, which is the cost is not spending the time getting promotion and tenure, perhaps, because you're not going to get rewarded. But a few universities have actually taken to paying their scholars to write for the conversation or talk in public. Maybe it's only $500, but it's a signal. It's like a nudge. This matters to us. And once people get into that rhythm, they don't go back. They don't go back into that hermit hole of only academic journals. So it's just something to think about as we think about how to solve this really complex problem.
That's wonderful comments, and I'll note that I feel like we're connecting well with what our questions are on the audience's mind, because we've had two questions just about the tenure system and some of these barriers, these obstacles to connecting more deeply with the public. So I do want to encourage those that are listening to drop a question in, and we'll certainly do our best to answer them. And I'll also note that if there are questions that we don't get to, we will try to provide answers after the session is over. So we've talked about a variety of different kinds of domains here: health sciences, what's happening kind of on the ground. We've talked about academia and in journalism, and we've mentioned some of the obstacles here. Certainly, the tenure system is a big one in academia. What are some of the other barriers to access? And by that, I don't just mean there are certainly economic issues, but if I try to read a biochemistry article as a public policy person, I'm going to lose some of the nuance there, and I'm wondering if there are both barriers to that kind of access and understanding, and if there are potential solutions there. So Lacey, you probably see this in medicine a lot. It used to be called Dr. Google. I don't know what you call it in the AI age now, but are there challenges there, and are there opportunities with respect to open access?
Yeah, with regard to interpretation of the data that's available, is that basically what you're saying?
Yep.
Yeah. Um, yeah, and I think that only when I was in medical school they started training us in evidence-based medicine, and it makes you wonder what the heck were we doing before evidence-based medicine? But EBM was all the thing like 20 years ago when I was in medical school, and so I think that I appreciate that I get to be on a call with people from other disciplines because I recognize even in a field where we have explicit training in interpreting the evidence, many people are still at a loss. When I came to my institution where I'm currently at, it's more of a community institution, and I was advocating for practicing evidence-based medicine to one of my partners, and he said, "Oh, you can find a paper that says anything," because he wasn't really trained in and familiar with the fact that, like an animal study or an opinion is not the same as a meta-analysis where a bunch of randomized controlled trials have been done. So I would say that that is a truth across disciplines, and that really in our communities, we lean really heavily on professional societies who do the service of translating all of the evidence into clinical guidance, protocols, algorithms, clinical practice guidelines, which is really where I'm investing my efforts, because that is what, the nurse practitioner who might see this problem once every 6 months who's in rural Rwanda, or the house officer, et cetera, having access to the primary literature should be the case, and it's a right. And also, it's insufficient to just have access to the primary literature. You need point of care guidance.
Yeah, it's one of the most depressing phenomena or pieces of our experience that we encountered when we were putting together the Open Access Book Prize funded by Arcadia is as we talked to faculty and we heard over and over from people that an open access book or article doesn't count because it's only digital. And we too, Lacey, lean on societies and university presses and academic adjacent presses to assure the public that this knowledge is reliable, that it represents state of the art. And of course, then, all the work of the kind of work that Beth does. I mean, increasingly, I think scholars are working with editors who are more aggressive in saying to them, figure out what you want to say it clearly. And if you're writing on topics, I mean, particularly for scholars writing on topics like African American history or gender studies, trans studies, queer studies, I mean, I don't want to limit it to that, but I mean, especially focusing on those topics that are in the headlines, the presence of open access is having a galvanizing effect on what scholars, I think about for their work, their vision for the audience their work can reach. And I think that's a huge, and it's very difficult to measure this impact, but the conversation among scholars has really changed. I think when I was coming up in graduate school in the 90s, there was just no real way, unless you were kind of a megalomaniac, to think that your research was going to reach the public. But or a significant piece of public communities. But now it can and it does, and that has it's slow in some fields, it's faster in others, but it is changing along with the mechanisms that are of evaluation that we already talked about.
So I can just jump in. Like, I have a question because we could run into this a lot, and I think it's maybe one of those obstacle things, and maybe there's a solution. We often will reach out to an earlier career scholar who's really eager to write for us. And the barrier, forget they're willing to put the time in. The barrier is a reputational risk more than anything else of their peers because they study one thing in a very narrow area and there's only like 25 people in the world study it, or maybe 20. And they're fearful that the hierarchy of the system is going to give them demerits in some way. And I'm just curious, is how do you solve for that? Because we come across that in when we try to get people to write sometimes, and it's very disappointing. And yeah, I'd like to hear what you guys think.
Well, I'd quote Ashley Farley, who's more of an expert in this than I am for sure, who I think we have the privilege of having on the call. Of we asked her to speak on this top on something adjacent to this, and she said, "Take back your power." I think I have a good friend who's an accounting PhD, and there are maybe two journals that he has to publish in order to be considered for promotion, and it is as much of a club as it sounds like. If those editors of those journals, and none of it's blinded, et cetera. And so I think that we we in the clinical space, I think, why are we doing any of it? Well, we're doing it to save lives and to prevent suffering. So then you go to the end user and go, hey, end user, when you have clinical uncertainty, what do you want from information sources? Where do you go for information and what do you want from those sources? And then we build backwards from there. But instead, we have a system that is perfectly designed to get the results that it gets. And that is to enrich the publishers and to align with existing hierarchies within academic institutions. But it was never designed to, again, in my field, it was never designed to prevent human suffering or to save lives. And so I think it's an opportunity to really redesign the ecosystem and figure out how we can align incentives so that we are actually doing something that ladders up to the why that would be worth us all getting out of bed for.
If I can add to that, I want to acknowledge because we've talked about societies and professional academic scholarly societies, whatever name we call them, and in the U.S. for sure, which is the landscape I know best, the the financial constraints, particularly on scholarly associations publishing journals, are really real. So everybody's also functioning. Many people wish to change. They talk about greater acceptance and that awful problem that you point to, Beth, of being suspicious of someone who writes generalist publicly accessible work because they're not serious. I mean, I do think, again, we've seen a change there, but not enough. But at the same time, it's underlaid or constricted by financial scarcity. And so long as journals don't have scholarly journals, whether they're supported by societies or not, but especially I'm thinking about societies because of where I am at ACLS, which is a coalition of over 80 academic societies. The business model also, along with, as Lacey says, I mean, this is part of the ecosystem and it needs a refurb. It needs reinvention, and we need to think. And people are doing this big thinking. Some people on this call, I think, from the names I'm seeing, about how we think about the flow of money, so that those end users, who are the public, who need to understand health, history, culture, languages, art, society, religion, can get the knowledge they need. But right now, the financial system too is tilted against it.
I just want to remind folks to put questions into the Q&A, into the chat, and we'll make sure and get to them. And we are approaching our Q&A section, but I do want to ask the panelists to consider a closing thought here. If you could change one thing about the current, we'll say, rather polluted information environment, what would that be? And so this is a magic wand question for Beth, Joy, and Lacey. And whoever feels like they want to attempt this first, please go ahead. And if no one raises their hand, I have something.
Are you talking about just the vast misinformation ecosystem we're living in? Is that?
I think that's a great starting point. Yeah, absolutely.
Yeah, look, it's a challenging issue, you know. I think the way you fight a tsunami of misinformation is a bigger tsunami of facts and expertise, but expertise explained in a way that people can understand it. You don't say, I'm an expert in this, so therefore you should trust me. It's like, I studied this. I've been in Malawi studying, or I've been in I've been in OASPA in Ethiopia studying hygiene and of water habits for 30 years, and I've seen children die from lack of, and that's where my perspective coming from. So I think it's fight it with a tsunami, but also the experts in our world need to learn how to connect better, I believe, with the general public so that trust is built. And merely saying I'm an expert or having a PhD does not cut it for the average person, I think, anymore today.
Is that okay?
Yes,
I
please
think
go ahead.
in my space, we are between two extremes of a hierarchical, frankly, patriarchal system in which you have to be government funded to get to publish anything. And then that information is only accessible to a select few, but that's truth. And if you don't have access to that truth, then the knowledge that is power is not You do not get to partake in that power. And then on the other screen, as side of the extreme, we have elevation of the community voice and acknowledging the importance of, and I think in medicine, I think this is across disciplines, but in medicine, in communities of practice, people around the world in high and low resource settings are using WhatsApp and Facebook to answer clinical questions, right? They're asking their peers and their friends. And I think this is a moment for us. We work with some folks at McMaster University, who are the ones who developed the grade methodology, which is the is this real or is it not science when it comes to clinical medicine. And so I think this is a beautiful moment for us to elevate the voice of the citizen scientist and acknowledge that the nurse at the bedside, et cetera, has a lot of wisdom to share, and to bridge that gap between that and what we have traditionally given a voice to in the meta-analysis and the RCTs that take 5 years to fund, 5 years to do, and then another 17 years to get into practice. And so because we are disenchanted with both for different reasons, now is a great moment for us to go, what is evidence? And how do we, again, anchored in our why, bring the best to the bedside?
Oh, that's great. And I got so caught up in Beth and Lacey's answers. What's my magic wand? I mean, I'm going to cheat and say two things really fast. I mean, I already mentioned the need to remake the financial ecosystem of scholarly publishing and circulation of, I would call it the production circulation of knowledge. But if I could wave a magic wand and have that done, I would do that. I would also, though, want to, and I'm thinking now specifically of humanistic and social scientific knowledge. We live, this is, I know, mega big picture, but we live in a time where the college and the university has become an instrumental, it's become, I was going to say it's becoming, it has become an instrumentalized space, talked of as a servant to the marketplace. And we need to take back that narrative and remember that colleges and universities produce knowledge of all kinds. Some of it is immediately applicable. Some of it is for the future. Some of it is about the past. Some of it we don't know what it's for yet, but our descendants will. And I think the open access movement by, both changing scholars' attitudes, as I already talked about, but by shining a light on the unbelievable advances we have made in understanding the way the world works from a humanistic perspective, from a psychological perspective, you can go on and on, that is part of the wand, actually, because it helps remind university leaders, legislators, trustees, donors, that the university and the college are bigger than preparing people for career readiness, which is the story you hear now. Not that that's not an important story, but it's just one strand. So that's the other magic wand I would wave to say, remind people of what the college and the university, what this amazing research system in this country produces and the role that it plays. And open access actually helps us do that.
That's wonderful, and a nice inspirational note to segue into our Q&A. And there have been several questions that have come in, and many are related to this obstacle that we surfaced earlier about tenure and promotion practices. And you all have mentioned a few kind of possible ways to get past that. Robin asks, in addition to the faculty reward system, I'd love to hear the panelists' thoughts on how we build and maintain the infrastructure needed to support an open scholarly public knowledge system. Great question on many people's minds. And currently I think universities are trying to delineate funds for institutional repositories, but is that really a sustainable model? And perhaps there are some better possibilities out there. Thoughts from the panelists about the infrastructure needed to, house and maintain and also make all of this data and information available. It seems very fragmented right now.
This won't answer for some of the some things outside of my discipline, I think, but we have the opportunity to develop virtuous cycles in which, again, anchored in our why, we have aligned incentives so that revenue can flow through the system in a way that supports open access and the patient and et cetera. And so I think there's one example is the in cancer globally. They're exceptional in making guidance available, public access to the world. And they've got 40 full-time employees who just all they do is comb trials and update these things and modify algorithms and translate, et cetera. And the way that they can do that is that reimbursement for these $20,000 infusions and all these expensive drugs is tied to whether the care provider is complying with the guidance. So there's a virtuous cycle. So then the hospitals pay into this organization that creates the guidelines because the hospital reimbursement is tied to these guidelines existing, because that's how they get their insurance. And so there are examples of virtuous cycles. It's not just we pay to the publisher has no incentive to make sure that it's open, widely available, but that it's anchored in what the purpose of that literature was in the first place. Obviously, I believe deeply in art, and other avenues where information sharing is essential, but also difficult to think of a short-term monetization plan. So I'd be curious to hear what other people think.
That's great, Lacey. I put in the chat a link to a report that ACLS issued last year, funded by the NEH that was, and the Mellon Foundation. The work came out of a multi-year report. It is a commission, I should say. It is absolutely not a white paper that should sit on a shelf and do nothing. It has recommendations, and I want to single out recommendation 7, which maps out and draws on existing efforts. And I really want to underline what people are saying in the chat, that there are ongoing efforts like Subscribe to Open that will do this work, that will carry this forward.
I just look at those recommendations. Those look really good. I mean, I don't know. I don't have, this is not, I don't, it seems very open access to the whole ecosystem from an outsider's viewpoint. It does seem very fragmented. I don't know how to solve it. But one thing, but speaking of, what I think about it a lot is how to make it easier for academics in their world to share their ideas with the public in an open access way. And one thing we've done recently, which is so small, but we've heard such gratitude from academics, is that everyone knows what DOIs are, and for a permanent link for your work. All our stories now have DOIs. We invested in that, and so it can be sort of look more academic and also be followed for impact. You know what I mean? All the way through a service called Overton. You can look in policy papers, and in universities it's becoming more and more important to have a real world impact. So if you can trace the story or the paper all the way through that, I think that has value back to the public. I mean, to the academic and to the university to value that sort of open access, whatever, however it's designed.
Beth, one question I've had about the conversation is, how do you get feedback from your readers about is it through, do you have like reader advisory groups, or do you have kind of comments that you comb through about the impact that these ideas are having on people's kind of everyday lives?
I'm muted. Yeah, so I'm laughing because no, we're pretty a lean and mean machine. We used to allow comments on most of our stories. Unfortunately, the trolls have found us in spades, like many places. So we can't afford to moderate them all. It's simply too expensive, unfortunately. So we try to do that. But people find us, even though we have a website and we've like 300,000 subscribers, just individuals who get it. So they're highly engaged. They often write us back and respond. We do reader surveys. But readers just find us. It's really weird. Even though the academic gets the byline and we're kind of at the bottom of a story in a news article saying this is a service of the conversation, they find us and they say, hey, because we have to do impact reports for all our foundation funders and whatnot. So we really care about that. Like, yeah, I know I took that and I went to again my school council and they changed the affordable housing policy and to benefit. It took 5 years, but that got us going. So yeah, that's how we hear back. I mean, it's not perfect, and we're working to improve it. But I don't know. Yeah, I'm curious how academics hear back sometimes too, like from their work.
I wish, and I bet, Amit, you agree that we had a clearer path. And when I think about I'm writing an article right now on foreseeable futures for the humanities specifically, and I'm trying to play around with some big ideas there about the way the university might look in 20 years. And when I say the university, I mean, there are so many different types. So one type. But when I think about a place that would engage multi-generational learning, and I think also about uh, just a place where the production of knowledge through technology, through digital technology, just gets smoother and smoother. I mean, when you think about the distance, as I said before, from where we were 25 years ago to where we are now, my big fear is that universities, that 17-year gap again, that universities will take a generation to catch up, and that as you've all said, the piling on of public mistrust and anger about high costs and inaccessibility of higher education will combine to push universities out of the knowledge production and circulation space. So the only way to get ahead of it is by embracing open access and by embracing the ethos that underpins it, that is making ourselves as open and engaged and starting developing the habit. Again, it's alive and well among many, but I would say not enough scholars, the habit of beginning from public questions and letting what one listens to and hears shape one's research project. I'm really inspired by some of my colleagues. I'm a scholar of ancient Roman literature and political thought, and you might think, where do you even begin? But my colleagues are incredibly inventive in working with high school teachers, working with kindergarten teachers, working with people teaching religion classes, and thinking about myth and thinking about what people think about the history of democracy, which is not just a Greek and Roman story, it's a much bigger story, a global story. But there are, however arcane, and there are some arcane areas of research we should be happy there are. We wouldn't have the health advances or the historical advances, any of the advances we have in knowledge. It depends on putting lots of pieces together. But I've heard just like mind-blowing stories from scholars who work on, Greek dialects from the 8th century BCE, and they have a line to, the high school in their town, and they bring the word. I don't know how else to say it. It's possible to do. So yeah, it's an ethos question.
Uh, Question from Monica. Are plain language summaries getting uptake? And I feel like, Lacey, you might be able to comment on this because I imagine that's plain language summaries are sometimes used in health journals for, sometimes they're called lay summaries. And now it's just drop that clinical report into GPT of choice and hope you're getting something that's correct.
Yeah, absolutely. Yes, I think most health sciences journals have picked something of like, give us 4 bullet points. They're a plain language summary, or some go so far as to say make a patient-facing version specifically of your content. And then yes, that becomes even more important because as we know, without open access, most of these LLMs, even there's one that specifically sits on top of the peer-reviewed health sciences literature. Actually, I don't know if open evidence is used in other disciplines, but it's just on top of the peer-reviewed literature. But even still, it's just reading abstracts. And if it does have access to the entire text, LLMs are not good at reading tables. So it's mostly summarizing for you the introduction and the discussion and not the results anyways. And so, yes, that's growing and people are looking for that, but not at the pace, when hearing Joy talk, I'm thinking that ultimately this is a delayed gratification opportunity, and we know we're not good at that. And it doesn't take something 17 years to spread on social media. And so, it's like fast, cheap, good, choose two. I think somehow we have to figure out how to be fast and good because right now what people are consuming is fast and cheap, and it's not good.
Yeah, can I just add on to that? I mean, but like I'm a judge for something called the Schmidt Science Communication Awards, and it is amazing to see what's being accomplished in for a layman's view of really good peer-reviewed science. Like it's amazing the creativity going on. I just like noting that it's lots of different ways of doing that in a way that's engaging. And the lay summaries are great in a print thing, but it's happening on social in a way that just really awe-inspiring, actually.
Um, Provocative question from Pierre, and who cites that 40% of Americans doubt that global warming is primarily man-made, and about the same proportion are unaware that there's scientific consensus on the issue, despite thousands of open access articles on the topic. Shouldn't this be seen as a failure of open access and as an incentive to go beyond OA and start doing things differently in science communication? Thanks, Pierre, for the question.
I mean, the one thing I'd say about that is like Jonathan Haidt writes a lot about this, and essentially we make decisions with our limbic system, and then we use our frontal lobe to explain the decisions that we've made. And so we know that data doesn't change people's. I shouldn't say that as a carte blanche, but almost, including for physicians. Data itself doesn't change, right? Story changes and emotion changes. So it's unfortunately not surprising.
Yeah, I would just add that I don't think that it's not a failure of open access. It's not a failure of research that's peer reviewed. It's again exactly well, they said it's a failure of communication. You know what I mean? And I think it's a really complicated thing. It's no one person's fault. There's no blame to be had. But when you communicate from up here, we're living in a much more kind of like a less hierarchical world in some ways for communication now, right? We know that. So if the communication is still coming from up here to go down there, you're not going to believe it. You got to meet people where they're at, and in a way that feels authentic and real. And you're seeing this more and more, particularly in the news ecosystem, as you have legacy news outlets kind of crash and burn. What you're seeing is trust. Trust is being found in content creators, influencers, if you will. That's not a bad word, but that's where people are trusting and finding really good horrible information too, but really good peer-reviewed information. And as we think about it as scientists, well, I'm not a scientist, but scientists and researchers and everything else, to think about meeting people like where they're at, as opposed to thinking they should meet you where you're at.
I feel like it might be a good time to say that at a moment when, in higher ed, where a lot of academic administrators, and I'm thinking especially of provosts and presidents, answering to trustees and nasty legislatures in some cases, not all, but they're really looking for flags to wave to say we're actually doing a pretty awesome job over here. You're being told this story over there, and a lot of it is false, and some of it are bits of truth. But let's tell you the real story, and uh, it is about telling the truth about history, culture, health, science, et cetera, et cetera. And what we need you to do, I mean, this is the message I think faculty need to bring. And again, people are, I hate to suggest that nobody's doing anything because people are working incredibly hard, but it is something I think for people on this call or scholars that in academia, this is something we need to keep saying again and again and again and again to administrators that, lift us up because we are doing great work and we're trying to reach the public and we are reaching the public and we are producing information and knowledge and arguments that are useful in the world and that give people hope and help them imagine and think creatively. So keep telling that story, shout it from the rooftops, and get involved and help us get involved, us faculty, us administrators, academics outside academia too, in our associations, in our societies, to figure out a new financial model and a new reward structure to make this work. So, but I guess my point is just at a time when academic administrators need some victories to talk about. This is something we need to lift up and say, we're trying, we need more, we want to do more, we can do more. Lift us up. You don't need to give us even much more money, although, yes, please give us money. I take that back. Give us money. But it's also like just lift us up and talk about us, put us on the table. Because I think open access I'll just say, I really only learned about it as a dean. And yes, I'm old, I'm 55, but maybe it's a generational thing. But people don't know about it as soon as they should. So that's also a message for faculty to make sure your graduate students and undergraduates are aware of the importance of understanding open access and this this landscape shift in the last years.
Well, we are just coming up to the end of the session here. It's amazing how quickly this has gone. It's been such a wonderful conversation. We'll end with this quick question from Patrick. What mechanisms exist or are missing for readers to assess the reliability of a published paper beyond just the prestige of the journal. Any thoughts about assessing relevance, quality, and reliability here, especially reliability? And I'll just note that this is a challenge. You have to have some kind of understanding of the domain to assess reliability, and citation is just, one very small, potentially flawed indicator of reliability. So I hate to say there's no easy answer here, and there's no kind of silver bullet. But generally, I advise students that if it's peer reviewed, you can take some solace in that, and it's always good to do some assessment of the journal that it's coming from, and to also look at some of the other papers that are in that realm, to see which papers are citing this one. And so, I think generally speaking, people are looking for an easy answer to very complex topics, and that's not always the case. But I think just the fact that peer review when it's done well can be a good way to separate what's reliable from more problematic results. Not in every case, though.
I just want to just add in what in the chat, there's just to make sure the data is, freely available for people, the underlying data seems like, so everyone's looking for people who really care, want to check it for themselves. And that's really.
Yeah, absolutely, Beth. Great thought. Just the embrace of open science, including open data, is always a good signal. Well, thank you all wow, what a great conversation. I'd love to keep going. But Lacey, Beth, Joy, thank you so much. And thank you all for joining us over the last hour. Hopefully this has been illuminating. It has for me, certainly. And with that, I'm going to pass it back to Ruby, but all appreciation from for myself and for the panel.
And a big thank you as well to you, Amit, for great moderating of the session today. I'm just going to paste in the chat some useful links, Amit, that you shared and had asked me to make available. So I'm just going to put those into the chat. Hopefully they are all clickable. They look good to me. So please do take a few moments to grab those resources. We will stay live for maybe sort of 30 seconds or so to give everyone a chance to do that. Once again, thank you all for joining us for a really insightful and vibrant discussion today. Bernie has shared in the chat some information on OASPA's conference. Exciting news, it's going to be in Zagreb in Croatia in September, the 21st to the 23rd, and registration will be opening soon. So if you go to the OASPA website, the event section, you will be able to see information on registration as soon as that opens up. And the events section of the OASPA website is also where you will find the recording of today's session. That should be available hopefully early next week, along with any questions that we haven't been able to get to today. So thank you all again for joining us. I hope everyone has a lovely rest of the day, and we look forward to seeing you on another OASPA webinar very soon. Thanks everyone again for joining us. All the best.